Hi, East Guernsey staff. This is Tracy Taylor, the school nurse here for Buckeye Trail. I'm here today to talk to you about the coronavirus or COVID-19. Today, we're going to cover the basics of COVID-19. We're going to discuss the school screening process and protocols. We're going to define isolation versus quarantine, and we're going to define ways that we can protect ourselves and our students while here. So some of you may have been researching the coronavirus, so some of this may be a review for you. Coronavirus is also called COVID-19. It is a severe acute respiratory syndrome, also known as SARS. There's two ways that the droplets can enter through, that you can get the droplets through the transmission. One is through air transmission when someone coughs, sneezes, or talks. The more forceful the air is coming from the individual, then the more of the virus that goes into the atmosphere. So when someone coughs or sneezes, more of that virus is going out, and then if you're just standing there talking to someone. You can also pick up some of the droplets through contact with a surface, such as doorknobs, sinks, desks, and eating utensils. So just please keep in mind to avoid touching your mouth, nose, and eyes after you come in contact with somebody or you touch high-touch surfaces. So just make sure you're always washing your hands or sanitizing, and avoid touching your mouth, nose, and eyes, because those are the ways that the virus will enter your body. Symptoms of COVID-19. As you're looking at this list, you can see that the symptoms are pretty much the same as anything that we've seen. Some of the kids present to me with allergies and have some of these symptoms, the flu, and have some of these symptoms. So it is very hard to distinguish, if they actually have COVID-19 without testing them. So some of the symptoms here are fever, chills, cough, headache, fatigue, shortness of breath or difficulty breathing, a sore throat, congestion or a runny nose, nausea or vomiting, diarrhea, muscle aches or body aches. And then there's also the loss of taste or smell. And with this and talking with health professionals in the area, the loss of taste or smell is something that they're seeing. If someone loses that, it is pretty much 95% that they, chance that they have COVID-19. So if you experience that or you have a student saying that, then please send them to the office right away, because pretty much that's that they pretty much have COVID with that symptom. When you're looking at the symptoms, some individuals may be asymptomatic, so that's what we're seeing a lot, and that's how it's the reason that we're having a hard time containing this is because not everybody shows the symptoms. Symptoms can also range from mild to severe, and the major thing is that they can appear from 2 to 14 days after exposure to the virus. So if you think about that, and if you don't know that you have the virus and you don't get symptoms until like day 14, how many people you've came in contact with. The protocol for students with symptoms here at the school: be sure that the student has a mask on. I know that some of our students will probably be exempt, but if you could ask them if they can just hold the mask or place the mask on until they get to the office, and then I can let them remove that if they're exempt from that. We'll just have to work with those circumstances. Give them permission to report to the clinic. With some of the students, if you can call or send a note with the student, because we've known in the past that students sometimes aren't always clear once they get to me on reporting their symptoms. So if you can send a note, whether they're coughing nonstop or whatever they're complaining of, if you can please send a note, that would be helpful, especially with the little ones. We have a COVID-19 screening that will be completed. If that student is showing the symptoms, then they will be isolated, and then the student will be sent home. Some screenings for staff. We would like you guys to self-monitor at home. So every morning, if you could check your temperature, make sure that you don't have any symptoms, that would be greatly appreciated. If you are having symptoms or you do have a fever, if you could please stay home. Students, we will do daily temperature checks. If they have a temperature of 100 or higher, they will be sent home. And then we will also just screen their symptoms throughout the day as they present. When you're looking at COVID-19, there's two different terms, isolation and quarantine, that you'll probably hear. When you're looking at isolation, this is the process to keep sick individuals separated from the healthy individuals. So if you send someone to me with symptoms, then I may tell you I'm sending them to isolation. The infectious period for COVID-19 is 2 days before the onset of symptoms and then 10 days after the onset of symptoms. And then they can end isolation when they are fever-free for 24 hours without fever-reducing medication, or when their symptoms are improving. But it's always a minimum of the 10 days. Our school isolation room is going to be in the blue building down where the old administrative offices were, is where we will be sending students if they're in isolation. The quarantine is when you restrict the movement and contacts of healthy individuals. So if you were in contact with someone who then tests positive for COVID-19, then you're going to be put into quarantine and probably tested until they can find out if you are positive or negative. A quarantine period is 14 days from the last contact with the infected individual. The health department will be the one who will take care of who's going to be in quarantine, and what they do is contact tracing, and they will look at close contacts of the ones who are in isolation or tested positive for COVID. The ones who are considered close contacts are those who are face-to-face contact within 6 feet for 15 minutes of the individual with COVID, are living in the same environment, or have direct contact with the individual, such as kissing or having any kind of contact with their secretions, such as picking up used tissues. So please keep that in mind. If you have a student that you're helping, please make sure that you don't use your bare hands to pick up anything that their secretions have been on. What if there is a positive test? The Guernsey County Health Department will be notified of any positive test. The health department will implement the contact tracing. The health department will notify any close contacts who need to quarantine. And the school, we will work closely with them on this because of our assigned seats and who are in the classroom, who might be on the bus. So we will be working very closely with the Guernsey County Health Department. If you are in quarantine, then you must have a return to work slip. Or if you have tested positive for COVID, you must also have a return to work slip from the Guernsey County Health Department. So how do we slow the spread of COVID-19? Be sure to practice social distancing. 6 foot is the ideal distance. Wear a mask or other PPE, which is personal protective equipment, as appropriate. Wash and sanitize your hands to prevent the spread. Thoroughly clean and sanitize surfaces. We're going to have adequate staff and student screening, and stay home when sick. With social distancing, if you guys can please look at your classrooms and allow as much space in between students as allowed, or can be promoted there in your classroom. 6 foot spacing of students is the best, but I know that some classrooms, we may not be able to do that at all times. So that's when the masks are very important with the students. We're gonna have visual cues on the floor markings and halls and the signs in the hallways, maybe, directional traffic. We're gonna hang education signs on hand washing and social distancing and how to prevent the spread of germs. At lunchtime, we're going to utilize different areas for lunches. We're going to stagger the times, and there will also be assigned seats so that if we do get into the situation of having to do contact tracing, we know who was around that student at the time they were eating. If you can stagger the use of lockers and cubbies, please don't let all the students go to their cubbies within the classrooms all at the same time. And you guys can develop how you would like to do that. We're going to limit visitors into the building and anybody that's non-essential. And then with busing, this is, it's going to be hard, but we're going to just social distance the best that we can. So, 2 people per seat, they're going to have to wear their masks. They're going to have to sanitize when they get on the bus. We're going to put family members together as much as possible to avoid any of that contact outside of the family. When you're looking at personal protective equipment, or PPE, masks is the one thing that is the most common talked about. These must be worn by all staff and students. If a staff or student is unable to wear a mask within the building, then we need a physician statement covering that. Recommendations when you're wearing mask is avoid touching or adjusting the mask once it's applied. Make sure it fits tight and comfortable. Make sure it's clean. You should wash it daily. And then mask breaks are one thing that's going to be based on the classroom. So if you have students that you can social distance, then give them a little bit of a mask break. I know some people have talked about in the younger classrooms maybe putting squares around the classroom, and if the students spread out and sit in their square and are just reading an individual book, take that mask off for some time to give them a little bit of a break. Another PPE is shields, which the governor just put out the other day that the shield is not recommended as a substitute for a mask by the CDC. So if you are wearing a shield, please also include a mask if you are not able to maintain that 6-foot distance from an individual. If you're using a mask, please make sure it extends down below the chin, and those should also be cleaned daily with a disinfectant. Hand washing and sanitizing, we need to promote frequent hand washing with the students. They need to wash their hands for at least 20 seconds. Make sure they're washing their hands when their hands are dirty or after recess, before and after eating, and of course after using the bathroom. Hand sanitizer can be used in between those times. There's sanitizer stations located throughout the building, and I know there's some in classrooms now. So maybe when they're entering the classroom, make sure that they use the hand sanitizer to kind of wash their hands. The cleaning of surfaces, clean all high-touch areas in between students or daily. Avoid having students share classroom supplies that cannot be cleaned. Water fountains will be blocked within the building, but they can still use the upper part that will fill up water bottles, and everybody's encouraged to bring their own water bottles. If you have a student who does not bring a water bottle, please let the principal or office know so that we can get them some water bottles. Remove items from your room that cannot be easily wiped between students. So any cloth material, or I know some of you guys have had pillows, we're asking that those be removed just because they cannot be sanitized. Now, if you have items within your classroom that can be easily wiped down with a wipe in between each student and can dry, then that's fine. Also have students help with cleaning their areas. They need to learn this. This is going to be the way of life, so they need to learn to clean up after themselves and before they're sitting down. So have them help you. So we are all in this together. Just please do not let your guard down. Stay positive for the students and other staff, and don't be afraid to ask questions. And don't be afraid to call me or come into the office if you need to talk to me about something. I may not always have the answer, but I will find the answer. So I'm glad everybody's back and look forward to seeing everybody. Thank you.